Hey guys, it's week 3 in a few days, and I haven't done an update in a while. I kind of felt like I wasn't progressing like I should have been, so I got really down on myself and depressed, and just sort of didn't want to post anything if I didn't have anything new to say. So within the 3 weeks, I can tell you what I've started doing a little bit of. I can walk to my downstairs bathroom, which is not that far, it's down the hall, with or without my walker, so that's different. I can sit up at the end of the bed, or side of the bed, with my feet propped, so nothing, like my feet can't hang over the bed. It's bad pain. So as long as I have like a footstool underneath my feet, I can sit up for about 20 minutes before I start to feel woozy and pain. So that's changed. I can move around in my bed on my own, so I can grab onto the 2 handrails of my bed and shift myself side to side. The only thing is, if I drop something on the floor or like the pillows come off the bed, I'm stuck. I can't move to get them, so I kind of just lay in a very uncomfortable situation for me. I tried today to lie on my back and still no success, and it's getting me I tried to make a donut so that I could take some of the pressure off of my lower back while I was doing it, and I kind of had 2 people lift me onto the donut shape, and we just prayed that I could sit up for even 5 minutes to get the pressure off my hips, and sadly that didn't happen. So that was kind of crappy, and every kind of failed attempt does kind of play with your mind. It makes you depressed, and it kind of shoots down your kind of desire and motivation to keep going. So it's really tough, but it's good to have people around to kind of say, you know, at least you tried, I'm proud of you, good job. Like, that really helps to keep motivating you so you don't get down on yourself, because the things I'm noticing with contacting people that have had microdicectomies, talking to people and hearing their stories and sharing their stories, it's a lot mentally to handle. It starts to play with your mind, it starts to play with your emotions. You get sick of feeling this way, and from what I gather, it's going to be a very, very long time till I'm back to myself again, if I can even remember what myself feels like. They said it's going to be about a year to completely come back to somewhat normal. Others say that you'll never again be your normal self. You're going to be limited with things that you can do, and I've noticed a pattern with the 3rd to 6th month with post-op having pain. A lot of people are getting sent back to the emergency because they're having sciatic pain. Their nerve gets inflamed. There's a lot of scar tissue that forms and causes pain, causes pressure on your disc, then can protrude your disc again and cause another herniation, which I'm finding a lot of people are complaining that they're getting sciatic, numbness, tingling, pain in their stitches, in their incision, where it feels like it's tight and it's pulling, and I feel like my back is like a plank, like somebody laid a plank across my back, and I can't move it. It's very stiff and sore and tight, and it's just like I could feel my spine kind of collapsing in on itself, and it does not feel strong. I do not feel secure when I'm standing, and I think a lot of it has to do with fear. I'm scared to move because I don't trust myself. I don't trust that I'm going to not fall, or it's weird. I can't explain it unless you're going through it. Having numbness since June of 2014, it's like not feeling your leg, and then all of a sudden now having to feel your leg is weird. It's something to get used to. It's unusual for me to now trust that my leg can hold me. With the herniation, I had many falls. I had a drop foot where my foot would just go and I would be tripping all the time. So it's unusual to not want to rely on your walker or your cane. I walked everywhere during the summer with a walker, a cane, or the help of somebody. So it's really strange now to not have that. So it is a lot of mind stuff. It's a lot of, you have to get through the mind part of it as well. It's not just like, you've had the surgery, you have the physical pain, but you also have the mental pain of how much things were taken away from you, and how you have to kind of find yourself again. And I'm struggling to find myself. I'm struggling to kind of let go of that fear of, oh my gosh, if I do this or turn this way or pick up this, that I'm not going to have that popping, slip disc herniated type of feeling that we're all familiar with if we've had the microdicectomy surgery. It's scary. It's kind of like it's scarred me a little bit, and it does worry me, and it's going to be in the back of my mind for many years, to be able to trust myself again, I think. So that's a battle that I'm dealing with. The evenings are still really tough. I have my breakdowns in the evenings. I cry. I feel very agitated. I want to run. I have muscle spasms at night. I have sciatic at night. I have just an overall tightness in my muscles feeling that doesn't go away, and a lot of incision pain. I'm still quite swollen in my back. It's kind of like a square. I'll have to do a video tomorrow of my incision so that you can see what it's looking like now at the 3-week mark. And I'm getting a lot of messages saying that, 3 weeks is nothing. It's really when you get to the months point that it starts to kind of, okay, you're at the first month, the second month. You don't really count, the first couple of weeks with healing, because it is a roller coaster. Every day my mom says that she's going to take me to the hospital, and I keep on saying, no, let's just hold off, let's see what happens, because I don't want to put myself through that trauma of going to the ER unless it's absolutely necessary. There has been a couple of close calls that I felt like I needed to go, but I've held off. And it's really just about listening to your body and what you feel is healing and what you feel is not healing. It's really scary to think that I could develop scar tissue, and that could affect my back as well for years, if not for life. So that scares me. So it forces me to walk, even though I don't want to, and I try to hide that it's not absolutely horrendous pain for me to walk. I just do it anyways. I know it's better for me now to walk and take it easy around the house now, and rather than get the scar tissue and have complications down the line. So I am walking more around the house. I'm still in the hospital bed downstairs. It's easier for me. I can take my sponge baths down here, and I'm able to be with family and friends down here instead of recuperating in my bedroom where I'm alone. I recommend, if you can get a hospital bed for your surgery, you rent it. It's like $200 to rent, and to rent a walker, and if you can find a full-length body pillow. I think those are the 3 things that you definitely need. I have a lot of heating pads and like the beanbag heat pads. I have ones that I can wear on my feet, ones that I have on my back, ones for my stomach, and I can't live without those, and ice. If you can get the those blue ice packs that are soft and moldable when you put them in the freezer, those are absolutely amazing, and can't live without those. So just little ideas for you guys if you are having the surgery, and if you can do that, even if it's renting the bed for a couple of weeks, even the first 2 weeks, it's worth it, because the head goes up, the feet go up, you have full control of your bed and getting in and out, so you don't need the help. It's worth it. And really, it's just, I'm just getting through the day the best I can. I'm trying to stay positive, even though a lot of people around me are still struggling with their surgery and their recovery. There has been a lot of setbacks and struggles, but I think it's all in the way of progression and healing and recovery. I think it's to be expected, especially with somebody like me who has fibromyalgia and isn't well. I think it's going to be a longer road than normal. So I just have to keep reminding myself and my family that this is tough. It was a major surgery. The herniated disc itself, sitting with that, living with that since June, put a toll on my body. I had to learn to walk a different way, sit a different way, get up a different way. I lived with a disc literally putting pressure on my nerves for months, and now my body doesn't know what to do with that information, and they say that nerves heal 1 millimeter per day. That's how slow it takes to heal your nerves. And my nerves have been cut, obviously, since surgery and things like that, and muscle has been cut, bone has been cut. So these things take a very long time to heal and get back to normal. So I'm hoping that it gets better. I can only be hopeful and be positive and make videos for you guys, so you know my journey and hopefully learn something from my journey to help your journey. And I guess that's it. So have a good night. Bye.